Today, I will talk about management and homeopathy treatment of conduction aphasia. This conduction aphasia, it is a type of language disorder and it affects a person's ability to repeat words or phrases, even though he can understand speech and speak fluently. This disease, conduction aphasia, results from the damage to the neural pathways connecting the comprehension and speech production centers of the brain, mainly the arcuate fasciculus, which connects Wernicke's area, which is the language comprehension center, and Broca's area, which is the speech production center. We get symptoms like fluent but interrupted speech. Speech is normal in rhythm but filled with pauses and corrections. Poor word repetitions are keynote symptoms, where patient express inability to repeat sentences or unfamiliar words correctly. Word finding difficulties, it is medically called anomia, hesitation or substitution of similar sounding words. If we go through the etiology, we can say conduction aphasia usually results from brain injury or neurological damage to the arcuate fasciculus or some nearby region. Major causes include stroke. Commonly we know this is cerebrovascular accident. Most common cause due to blockage or hemorrhage in the left hemisphere. Sometimes symptoms like head injury or trauma may be the etiology, affecting the dominant temporal parietal region, which is the left side. Sometimes, though it is rare, infections or inflammation may be the cause because of diseases like encephalitis and meningitis. Before going to the treatment process in homeopathy, we insist patients to have some management. While complete recovery depends on the cause and extent of the brain injury, rehabilitative and supportive management can greatly improve language skills. So, speech and language therapy is important. Repetition and naming exercises, this is a practice. Gradual retraining of the brain for word recall and repetition. Phonemic cueing, this is a great strategy to manage this conduction aphasia, using sound cues to trigger the correct word. Reading aloud and writing practice, we insist patient to do this. Why? To strengthen verbal motor connections. Sometimes we insist to take auditory feedback training. This is recording and replaying speech to self-correction. In most cases, we insist also patients to have cognitive and neuro-rehabilitation. Brain training exercises, memory drills, and problem-solving games are important in this regard to improve neural plasticity. Now, as I have seen several patients, according to my experience, I will talk about homeopathy treatment for conduction aphasia. Homeopathy can be used as therapy to stimulate nerve regeneration, improve speech, speech coordination, and reduce mental fatigue or frustration. Commonly indicated remedies are lachesis, phosphorus, baryta carbonicum, and stramonium. If I talk about the polycrest medicine, which is commonly chosen by most of the neurologists, lachesis higher potency works well when we get symptoms like words mix up, confusion in speech, fluent speech, but words come out wrong or incomplete. Sometimes moderate potency of phosphorus, this is also a great polycrest in homeopathy. I have prescribed several times when I get symptom, great nervous weakness, difficulty finding words, loss of memory of names or recently heard words. This medicine, this polycrest medicine phosphorus higher potency works well. It is suited for degenerative brain conditions as well. One of the chosen medicine which I had prescribed several times, which was Baryta carbonicum. Moderate potency of this medicine works well if we get symptom like slowness in comprehension and speech. It is suited for elderly and post-stroke patients with hesitant speech. Finally, one more great polycrest, stramonium. Stramonium moderate potency is used when the indications we get speech incoherent, jerky and distorted, brain excitation and confusion. Finally, this homeopathy remedy selection must depend on totality of symptoms, constitution and causation. Self-medication without professional supervision is not advised. Thank you.